dear Professor Gernshou, dear everyone in this hall. I'm very honored to stand here to give a lecture for the application of acupuncture in psychiatric disorder. And I'm the first affiliated hospital of China Medical University. We all know psychiatric disease is a syndrome characterized by clinically significant abnormal cognition, emotion, or behavior. According to the World Health Organization, the burden of diseases caused by neuropsychiatric diseases accounts for nearly 1/3 of the total disease burden in the world. Among the top 20 diseases that cause disability, there are 5 kinds of psychiatric diseases, of which depression ranks second, and psychiatric disease is a heavy burden for patients, families, and society. And we know the treatment of psychiatric disease. We know drug therapy, psychotherapy, and physical therapy. And now we focus on physical therapy. And physical therapy includes acupuncture, electroconvulsive, repeated transcranial magnetic stimulation, vagus nerve stimulation, and deep brain stimulation. And we know there are many limitations of present treatment, such as drug therapy. We know 33% of patients with simple drug therapy fail to remission, and drugs generally have side effects and lack of effective means of handling side effects of drugs, and people can't tolerate drugs or don't take medicine. And for psychotherapy, the curative effect of psychotherapy is influenced by disease, human and environmental factors, and the effective fluctuate. And the indications for psychotherapy are limited. So I want to tell you how the acupuncture, and acupuncture refers to puncturing needles into human body at a certain angle under the guidance of traditional Chinese medicine theory, and stimulating specific parts of human body by means of needling manipulations such as twisting, lifting, or inserting, so as to achieve the purpose of treating disease. And the following picture shows the latest acupuncture map published in China. The meridian network is typically divided into 2 categories, and the Jingmai or meridian canals and the Luomai or associated vessels. The Jingmai contain the 12 tendinous muscular meridians and the 12 divergent meridians, the 12 principal meridians, and the 8 extraordinary vessels, as well as the Huatu canal. And this is a mechanism of acupuncture therapy. And acupuncture can cause a variety of cellular function changes in the stimulation area. Local electroacupuncture stimulation can cause peripheral blood platelets, epidermal cells, fibroblasts, mast cells, macrophages, white blood cells, and other cells to secrete and other non-neuroactive neuromodulators. And these secreted inactive neuromodulators act on the corresponding receptors of the affected nerve. And this is a complex mechanism of acupuncture therapy. We know there are 2 paths of the transmit and from part of 合谷 and 足三里 and by spinal cord by dorsal column medial lemniscus tract and spinopharyngeal tract, spinal thalamic tract, and by dorsal nucleus, thalamus, and locus coeruleus, and then go to cerebral cortex, subcortical nucleus, and cerebellum. And another way from Hyde Park, like and Taiji and Yinlingquan, Baihui, and Yanqing, they all reflect trigeminal sensory pathway and then trigeminal sensory nuclear complex and to dorsal raphe nucleus and to thalamus and to locus coeruleus, and then they are cerebral cortex and thalamus and locus and the cerebellum. So I think there are many mechanisms for acupuncture treatment of psychiatric disease, mainly the following 7, and 1, modulating of neurotransmitters and corresponding receptors, serotonin and norepinephrine. And the third one is modulation of Doppler systems, and third is Doppler, GABA and glutamate, and fourth is neuroendocrine, the HPA-X and HPT axis, and the fifth is of neuropeptide, and the sixth is modulation of cell signal transduction pathway, and the seventh is modulation of inflammation and cytokines. And that's all. And we all know, introduced you 4 methods of acupuncture therapy. And the first one is manual acupuncture, and the second one is electroacupuncture, and third one is scalp acupuncture, and the last one is auricular acupuncture. And today I will introduce the MA and the EA. Manual acupuncture therapy. MA is guided by the theory of traditional Chinese medicine and directly stimulates the shu points by hand. It has a very good medical and health care effect on the strengthening the body function, dredging channels and collaterals, harmonying yin and yang, and stressing the body and removing pathogens, preventing and treating disease. And MA has the advantage of wide indications, obvious curative effect, and economic safety. And now we will introduce some studies of the acupuncture. And the first study is there are 46 female depression patients and 22 in war room MA and fluoxetine group, and another group is 24 in shame MA and fluoxetine group with 8-week treatment, and compare with shame MA. Clinical improvement is indicated by decreased grass and SDI scores in war room MA group, and we know the picture B is war room group showed significantly increased resting state function connectivity between the left amygdala and the left subgenual cingulate cortex and pregenual cingulate cortex compared to the shame group. And the picture C is Wardroom group showed significantly increased resting state function connectivity between right amygdala, left parietal and putum compared to the shame group. Thus, we can draw a conclusion. MA affects the function of the limbic system, especially the amygdala and the ungulate cingulate cortex. And this study demonstrates the adaptive effect of acupuncture to antidepressant treatment and suggests that this effect may be achieved through the limbic system, especially the amygdala and the anterior cingulate cortex. And another cohort study of 8-year follow-up, and this study includes 8,487 newly diagnosed stroke patients, and following their stroke, and about 1,000 patients received acupuncture more than 5 times. And this is MA patient, and another patient, 1,000 patient received acupuncture from 1 to 5 times, and maybe 6,000 didn't receive acupuncture. And the conclusion is MA after stroke lowers the risk of depression. And another MA treatment of effect is that 126 depression patients randomly divided into drug group and MA at drug group, and the scores for 1, 2, 4, 6 weeks after treatment of MA at drugs group is significantly lower than drug group, and we can see the results in 1, 2, 4, 6 weeks during study all indicate MA can accelerate the onset of SSRI effects and reduce the adverse reactions of SSRI. And another systematic review includes 13 studies. We can see good scientific evidence encouraging acupuncture therapy to treat anxiety disorders as it yields effective outcomes with fewer side effects than conventional treatment. More research in this area is, however, needed. And now I will introduce electroacupuncture treatment. Electroacupuncture therapy is the product of the combination of Chinese and Western medicine. It's based on the treatment of acupuncture, and in traditional Chinese medicine, it uses electric stimulation instead of traditional acupuncture method to adjust the intensity of acupuncture according to the magnitude of electric current. It combines the diagnosis of Western medicine with the syndrome differentiation of traditional Chinese medicine, and choose different acupunctures to treat psychiatric disease and symptoms. And this is a systematic review and meta-analysis. They include 1,046 case number, and in the punch score of 17 items is lower in EA combined with selective serotonin reuptake inhibitors, and therapeutic response rates higher in EA combined with SSRIs. The response rate was defined as the proportion of subjects who had at least some improvement in their level of depression following treatment, and the assessment method different between studies, including EA combined with antidepressant is more effective. And there is another study, 160 patients with MDD, and one group is proceeding, and the other group is manual acupuncture and proceeding, and the third group is like acupuncture and proceeding. And the clinical outcomes is acupuncture groups produced a significantly greater reduction compared to production alone, and the patients need to increase production dose due to worsening of symptoms was significantly greater in group with proceeding alone. And at week 4, the improvement is greater in EA proceeding compared with MA and proceeding, and no significant differences of adverse environment were observed among the three groups. And in conclusion, acupuncture can accelerate the clinical response to SSRIs. And another effect of EA treatment for schizophrenia, this article is only one schizophrenia, and 60 schizophrenia patients with auditory hallucinations, and one group is risperidone and at real electric acupuncture treatment, and another group is risperidone and at shame electric acupuncture treatment, and the clinical response rates and the real electric acupuncture group is 43%, and the shame electric acupuncture group is 13%. And in conclusion, EA might provide improvement in auditory hallucinations and positive symptoms for patients with schizophrenia partly responsive or non-responsive to risperidone monotherapy. And I know the limitation of acupuncture, and we have not enough understanding about acupuncture in treating mental illness, and the acceptance is not high. And the third is the number of doctors trained in acupuncture is insufficient. And the third is clinical research design is not strict, and insufficient standardization of clinical treatment programs, and the fourth is a lack of large, simple, high-quality clinical trials. And I think the future prospect of acupuncture has made some progress in the research of mental illness treatment, but there is still much room for improvement and development. And the traditional acupuncture therapy has a complicated theoretical system and operation method. In the future, the theory should be turned into practice as soon as possible to form a standardized and operable treatment mode. And psychiatrists can be given simple standardized training on acupuncture treatment to be better engaged in clinical work and scientific research, so that acupuncture treatment can be better applied to the treatment of mental illness in the future. And thank you for your attention, and I feel apologize for my poor English. Thank you.